So, good morning, everyone. My name's Andrew Thompson. I'm part of the team at Physiocare Rehab. Um, this morning, I'm going to do a presentation for you on the use of shockwave therapy for plantar fascia and Achilles tendon pathologies. So, first of all, what is extracorporeal shockwave therapy? Can be abbreviated to ESWT. You might see it written like that. It's a therapy technique which we offer in clinic at Physiocare. It is a safe and non-invasive therapeutic technique, which essentially uses a machine with a handheld device, which you'll see an image of a bit further down the presentation, which you can use to give shock waves to an individual, to a targeted area which you may be experiencing an injury in. So in this presentation, as I said on the first slide, we're going to look at the use of shockwave for the Achilles tendon and the plantar fascia, so areas around the heel and foot. The shock waves are approximately 1,000 times the pressure of an ultrasound wave. So in years gone by in the past, people have used ultrasound therapy in a similar way to try and help with the soft tissue healing process. But shockwaves, extracorporeal shockwave therapy, as I say, the waves in this use of therapy are 1,000 times the pressure of those. And the main goals and achievable things which research and practitioners have found with shockwave therapy is that it helps to reduce pain and increase function, which obviously are two massive parts of the rehab process for musculoskeletal conditions, such as Achilles tendon pathologies and plantar fascia issues. So in that sense, it's obviously a very, very good therapy technique which you can use and we can offer you. So a bit more detail about specific plantar fascia and Achilles tendon pathologies, because that's what the basis of this presentation is in relation to shockwave. So for those of you who don't know, the plantar fascia is a thick tissue between the heel and toes, so you would be able to feel it. Essentially feels like sort of hard muscle or hard skin underneath the surface of your skin on the sole of your foot. And it's commonly injured in athletic populations, but not just athletic populations, also members of the public who are on their feet a lot. You don't necessarily see too many acute injuries, so really short-term things that happen in a specific moment with the plantar fascia. However, you commonly see sort of chronic or insidious onset injuries, so things that come on over a long period of time as you subject the tissue to a really extended load. So think people like runners or people who are on their feet a lot for work will very commonly present with injuries to the plantar fascia. Similarly with the Achilles tendon, which you might know a little bit more about, the Achilles tendon is the tendon which attaches the muscles of your calf to your calcaneus, so your heel bone, and it's the plantaris tendon, the two heads of your gastrocnemius, which is the biggest muscle in your calf, and also your soleus, which sits underneath. They all join together to form the Achilles tendon, which attaches at the calcaneus. And again, obviously, you probably will have heard about people who experience acute Achilles tendon injuries, so Achilles tendon ruptures, which obviously has its own sort of long-term rehab. However, in this presentation and for shockwave generally with us, we're looking a little bit more at sort of long-term tendinopathies of the Achilles tendon, which again are very common in athletic populations. Runners, people who do sort of long days of work on their feet will commonly present with sort of long-term tendon issues at the Achilles tendon. And both of these structures are crucial in dynamic physical activity because you need them to be able to plant your feet, to run, to walk, to move, to change direction. And as a result, they're very commonly injured. So what does the research say about using shockwave therapy during the rehabilitation process for injuries to the plantar fascia and the Achilles tendon? Well, a 2021 study has found that shockwave therapy is continuing to gain popularity and can be used to treat chronic injuries to the Achilles and plantar fascia, as well as lots of other locations in the body. So what that means is that as time goes on, as more research is done, as more practitioners use shockwave therapy, the sort of people who are advocating for its use is just going up all the time. In 2012, a study by Wang found that shockwave therapy has been used as a treatment for MSK conditions for, at the time, 10 years, so now over 20. And again, in that time, sort of the adverse effects found have been next to none. They're minimal, really. It's just important that you ensure that you double check that an individual is able to have the sort of lubricant or gel on their skin, because you need that before you can put the handheld device on there. But other than that, it's just been found to be a really good, strong therapy technique. And then lastly, a 2022 study, so done just last year, found that shockwave therapy is superior to ultrasound therapy when treating plantar fasciitis. So, as I say, shockwave therapy in more recent years is continuing to be suggested as being the sort of wave therapy technique for these sort of chronic conditions such as plantar fasciitis, rather than in the past where some people tried to use ultrasound waves as a therapy. So what about the actual practical application and effects of shockwave therapy when looking at either the plantar fascia or Achilles tendon? Well, the administering of it is very similar for both. It tends to be 10 to 15-minute sessions of using the actual handheld gun, which you can see in the picture there. So we have one very similar to that in clinic, which connects to a bigger machine. You use the gel on the surface that you're targeting, and then you use the shockwave machine. As I say, for about 10 to 15-minute sessions, and it's important. Research suggests that you should have a session per week for anywhere between 4 and 8 weeks, and that gives you the best chance of helping with the healing process. So, without going into too much detail today, because this is just an initial presentation, essentially what it does, the introduction of the shockwaves can stimulate an increase in blood flow, which aids the healing process. And the details of that, as I say, if you come into clinic and we do some shockwave with you, then I'll go into a little bit more detail about exactly what's going on underneath the surface. But essentially, the basics are that by introducing the shockwaves, you're able to help the healing process, and the research does back up that. The other real big thing which has been found by myself and other practitioners and in the research is that it helps to reduce pain, in the sense that patients who have used a shockwave compared to patients who haven't, for pathologies such as plantar fascia or Achilles tendon, find that they report reductions in pain. The last thing, which is really important, which I'll vindicate for and most practitioners should do, is that it's important to use associated and additional exercise prescription alongside shockwave therapy. Shockwave therapy research and practitioners like myself have found that it is most effective when combined with exercise, as the shockwave therapy, as much as it can help to improve the healing process, reduce pain and increase function, it's the exercises which are going to increase the strength of the structures that you're rehabbing. And this is really important, because by strengthening those tissues around it, so the muscles in the calf, for instance, you reduce the chance of re-injury. And for a lot of people who have these chronic injuries, you might do it as a hobby, which you want to go back to, or if you do it for work, then you need to go back to it. So it's important that you strengthen the damaged tissues, because that means that when you go back to that same load, which has caused you to have a flare-up in the past, you've got a better chance of it not flaring up again. So it's important to prescribe these exercises alongside the use of the shockwave. And on screen now, you can just see a few of the examples of some of the injuries that we might prescribe if you came to us in clinic with a pathology in your Achilles tendon or your plantar fascia. As I say, just to help strengthen those muscles, so that in the long term you're in a better position and we can really smash your rehab. There's just some of the references that I used earlier on in the presentation in terms of research into the topic. I hope you enjoyed it. As I say, if you feel that this is an interesting topic for you, or you or someone you know has an Achilles tendon or plantar fascia pain, and you think that based on what the information I've given, Shockwave can help you, then please do get in touch, because we would love to help you at PhysioCare. Thanks very much.